Hello and welcome in today's nursing webinar session. Myself Shanti Bhattacharya, and we are just going to talk about the very interesting topic on self-concept and its impact on the communication. So let us see who we have today in this session. Let me welcome. It is my honor and privilege to welcome Mr. Rajkishore, who is a very expert in communication and very strong and extensive. He has got a very extensive skill in the communication and academic industry. He has extensively worked in the areas of scientific and theatre learning for most part of his career. He now consults starters on improving pedagogy and assessment. He was also from Azim Premji Foundation as a former faculty. I welcome you, sir.
Thank you.
And let me also introduce my co-moderator, who is Mr. G.K. Acharya. He is a group HOD for learning and development from Yashoda Hospitals. I welcome you, Acharya.
Thank you, Shanti. Good afternoon, everyone. Glad to be here.
And let me also welcome Ms. Sara, who is our speaker for today's session. She is Senior Nurse Manager from Yashoda Somajiguda Yashoda Hospital, and she is coordinating in a critical care unit. I welcome you, Sara.
Thank you, ma'am.
So to start with the session, the first opinion I would like to know from Sir Rajkishore sir, that why is it important, just because we have chosen this self-concept strategy for the nurses and for the healthcare professionals. So my question to you is, sir, like, why is it important to have self-concepts, especially for healthcare professionals?
Yeah, I'm going to read out something very short. It's a job description of for one particular profession. Just fill in for yourself. I'm reading it out. As X, you are expected to be assertive yet respectful. You will also be trained to be quick thinker when emergencies arise in the middle of the night. You will also get used to maintaining a positive disposition, since you are expected to exude and positive aura to your patients. Which career I'm talking about? It may appear that I am talking about nurses, but the page in my hand that I have it talks about the flight attendant's job description. So that's why I was intrigued when I read this particular ad in one particular in-flight magazine. I realized it also works for nurses. But when you ask anybody from the nursing profession, they may not be able to put their own profession there. Yes. That's where the self-concept becomes much important. So I realized I wanted to share this with the group today so that they know they are there to take flight in their own professional careers.
Yes. As you rightly said, that we can always choose our own flight towards our career destination. Having said so, hearing from your point of view, now the session will be over to Sarah. You can share the slides, Sarah. So we are talking about concept, and Sarah, you can start. Yes.
Good afternoon, ma'am. Good afternoon, all. My name is Sarah. I'm working as a senior nurse manager in Somajiguda branch. First of all, I would like to thank Shanti ma'am and Srija ma'am for giving me this opportunity. Today, I am going to speak about how self-concept impacts communication. Self-concept impacts in the nurses because they are having different roles and values, and they are having different beliefs as per their personalities. Self-concept is nothing but if a nurse is standing in front of a mirror and she is thinking about herself, what is she, and what is her feelings, what is herself, and she will be knowing what is completely knowing about herself.
Yes.
Self-concept in nurses can also influence an individually unique, because a person is there, they are different type of people, they are having very individual and unique personalities among themselves, and it also has different perception from one person to another person. We can see in the image as it is shown, a person is looking after 6 number, or it is a 9, but the perception of a person looking it is very different. But it can be one person can think that it is a positive, then other person can take it as a negative. this
So again, here we would like to know from, since we have GK and Mr. Rajkishore as well. So why self-concept is important in communication? Like we wish to know from your end as well.
Yeah, Rajkishore.
Yeah, when we start our career, we have our degrees, but that is not what we are. That is just one part of what we are. We are the individuals who have been nurtured, nourished, trained, blessed by many people in our life. It can be our teachers, it can be our professors, it can be our parents, it can be our relatives, it can be our near and dear ones. They make us what we are. Degree just happens to be a placeholder. So if when I come into any profession, I need to stand up for myself, speak for myself to the best of my abilities, and then proceed forward and do the expected professional qualities that I need to exhibit, that I need to perform, that I need to take into account. But ultimately, at the end of the day, in fact, at the beginning of the day, it is me, my own self-worth, my own self-esteem that will make my day, and days when they accumulate together, that will make my professional career. So at the beginning of anything that I do, it is me who is going to do it, not my degree. It is me who is going to do it, not my near and dear ones, not my professors. It is me. Therefore, the very knowledge of me is very important. So self concept, in short, we can say it is me, not in the I, me, myself kind of a me, but at least a more deeply philosophical me. That's what I mean, self concept. And in every profession, we need to shine through all these obstacles. For that to happen, we need to bring our self concept to the forefront.
Yes.
So what best than this career where we are a public facing service giving organization.
Yes.
Therefore, more so for us to think about the being a self concept driven individual.
So as I would like to hear from my co-friend who is GK, and as you do a lot of academic connect across in Yashoda Hospital. So what is your point of view, GK?
Yes. So, no, taking it from where my friend Rajkishore left, I think everything around us, the center is me. Right?
Yes.
Right
Yeah.
from the moment we are born, we are surrounded by situations, surrounded by people, and surrounded by activities. Right. So it's always the center is me. I mean, like he said, philosophically
Yes.
also, and more like me as an individual. So it's all around me. Look at a baby. I mean, when a baby is born,
Yes.
he's trying to communicate and tell his needs to his parents, minus the language. As we grow, as we get educated, we acquire language, right? We acquire linguistic skills and try to communicate using that language as a medium, right? And especially in a hospital, when we end up in a professional environment like a hospital or any other sector, it's all communications, right? It's me versus, if you take a hospital into the context, and if I take myself as a nurse, it is me with the consultant, it is me with the patient, it is me with the patient attendant, right? And it is me with the housekeeping and other support functions of the hospital. So it's all about me, right? And we are talking about a hospital where 50%, 60% of the manpower or the headcount are nurses.
Nurses.
And the entire hospital, probably there is only one core transaction which is happening, that is delivery of care.
Yes.
Right? And when you talk about delivery of care, the one person who's at the center of this entire caregiving profession is no one but the nurse.
The nurse.
So that's where I think we are talking about the majority of the workforce. We are also talking about the most important aspect of running a hospital, that is providing care. And in both cases, nurse is the center of the activity. So I think it's very important for a nurse, whether I'm a novice nurse or an expert nurse or I'm a senior nurse, to understand that everything revolves around me. What do I feel about myself? How do I convey my emotions and my communication to the other person? I think that forms the core of what we typically call in hospital lingo as the healthcare communication. While healthcare communication is a very scary and technical term, but I think it's a basic need of a human being to convey my feelings to the other person. In a professional context, a nurse has to communicate 1,000 things to 1,000 different people. So everything comes around that one entity, that is the nurse herself. So I think as a nurse, as any other professional or individual, as a nurse, more so, I should be very, sound, very clear about who am I and understand this concept of self. I think all the nurses who are out there listening to this webinar, you will immensely benefit from this particular concept called self concept.
Yes.
Glad that you brought up this topic of self concept, because if you understand what is self and basis that how do I interact and communicate with others, I think it will give you a new dimension and a new empowerment. So you can see the self improvement in yourselves, and end of the day, it's all about you. How do you feel about yourself and how do you communicate with others? I think in that context, this self concept is very essential, more so in a hospital context.
So let us also understand the point of view from Sarah. She's just going to take us or drive us through from the example that what is self concept and what is self esteem means. So she's going to give us the idea with the example. Over to you, Sarah.
Here we can see two nurses images. That one nurse is when I'm a good nurse. She will feel that she is a good nurse because she has all the abilities and she know all how to handle a sick patient and how to give high risk medication to the patient. In this view concept, she is feeling that she was a good nurse. But in the opposite direction, you can see that I feel proud to be a good nurse. She can feel proud to be a good nurse because she will be able to know that when we give the feedback, like judgment, how people are judging her, depending upon her work, what is the opinion that people are giving. Through that, she will be feeling that she was proud.
So here, what is the important, concept of self-concept? Like maybe what is the important component to, if rather as a head, I would say it is a self-identity. As Rajkishore sir and GK has already, enlightened with a lot of information that first let us understand what is my role. A nurse who walks into the hospital within 3 to 6 months, she should also, she's given a lot of training or some novice training, whether just to understand what is her role, and she understands herself, she looks at others for the help, and then that's how I think role identity also is very important. I think RK sir, you will also agree with this.
Yeah, I missed that word. What identity?
The role identity, the self-identification.
Yes. Coming back to this example, what you just mentioned, when we look at the people whom we are dealing, when we are self-aware, the kind of communication that will come forth from us would be much more interesting, because when it comes to a nurse, the way she has to communicate how a medicine has to be taken to a patient would be different than the way the patient has taken that medicine properly or not to the doctor. That would be entirely a different conversation. Same idea, but she will be dealing with two different ways of telling the same thing. When the same information has to be passed on technically from the doctor to the patient via nurse takes in the technical details and then passes it on to the patients in the most empathetic way. The crucial word is empathy. That is I see a parallel between a nurse's profession and a teacher's profession. Under no circumstances any teacher would ever say the child is bad. Never.
Yes.
There is always a better way of telling where the child needs a lot of help. Same can be said about patients and their body struggles to come out of that particular illness. So the kind of words that the nurse uses in communicating really matters, and the kind of words that comes from the heart of the nurse is entirely dependent on her own self-concept. If she is aware, if she is self-aware, if she is positive-minded, if she is professional to the core in communicating the content from the doctors to the patients and the attendants and the relatives of the patients, then that job would be much more smoother. Therefore, the core ultimately it reverts back to her own self-awareness.
Absolutely, yeah.
Now we are talking about a fresh nurse who have joined to the hospital. She is having a different point of view regarding the self concept. When she comes, we will be able to see her, see herself. Our abilities will be seen by herself. And again, as a mentor, for example, I am a nurse manager. I am having almost 50 nurses under me. I'll be I'll be supervising them. I'll be training them, and also see teach them what are this has to be done. Example like fall risk assessment, you have to do it in this way. These are the medicines that you are supposed to give to the patient in this way. This is the dilutions, and we will be teaching them, and after that they will be we will become the role model for them, and they feel that I should become like an in charge, like my supervisor, so that I will be able to do it very confidently. And I would also share my feedback to her, that how is she is working, whether what are her strengths and what is her weakness, so that self awareness can also influence their self concept.
So, Sarah, again, the question to you, as you have rightly mentioned that 50 to 60 nurses are under you and you are the mentor for them. So, you think this ideology of self and self-image, self-esteem and self-awareness are very important to understand one's self-concept?
Yes, ma'am, it is very important, so that nurses can be more confident in doing the things very skillfully, and they will be more confident in talking to the doctors.
Yes. So exactly, that's what we would like to, we were trying to understand. And I think, GK, you will also agree with the same?
Yes, yes. I think it's a very nicely framed slide here,
Yeah.
which explains the entire concept of
Yes.
self, right?
Yeah.
Who am I? What do you know? What I am today is my self-awareness.
Yes.
Do I know how good I am? Do I know where I am? That is the self-awareness. And then the point number 2 is the ideal self.
Ideal self.
Who I would want to be, or where I wish to see myself. So here I am, my self-image, where I am today, and here is where I wish I were.
I wish to become,
or I wish I were here. So you will see that the difference between who I am and who I wish I could be or should be, the gap between these two defines my self-image.
Yes.
Or the self-esteem, right? The point number 3. So if I see that who I am and who I wish I were, if the gap is too much, then definitely the self-esteem will be low.
Low, yeah.
So the lesser the gap between who I am and who I wish I were, more will be the self-esteem. Simple example, you take the patient who's at the hospital. Now, obviously, the patient is not feeling good about himself, so he is probably already having a very low self-esteem. Now, here is a nurse who's taking care of the patient, right? If the nurse doesn't have a very strong self-image and a self-esteem, definitely she'll not be able to tender the care to the patient. If I feel good, very good about myself, then only I'll be able to rub that goodness to the other person,
to the other
patient.
Person.
So I think that was a beautiful slide which explains the entire concept of self-concept vis-a-vis the hospital industry.
So well acknowledged, JK. You have really, given us the right example. It co-connects with the customer and the nurse. So over to you, Sarah, again.
Self concept professionally can also produce a very good outcomes, because they can make the patient feel comfortable, and they will also be involved into the plan of care. What is the plan for the care today? The doctors are going to plan whether they are going to extubate the patient. What is that? And they will be also able to take the strong decision making skills will be developed. If a patient is in a critical condition, if a nurse is at the bedside, she has, depending upon the condition of the patient, muse, she can take a decision to ship the patient, or any clinical decision can be taken by her. If she is doing all these things, automatically her self-confidence will be boosted.
So what will happen if her self-confidence is boosted, and where it is going to be resulting on, or what she is going to gain with this? Sarah.
Ma'am, she will improve her, she will have more self-concept, and she will be able to do the things very better in patient care.
Yeah, right. Very right. Yes.
So Rajkishore, would you like to throw some picture on this, a little light on this? how the positive self-image or a self-awareness or an esteem impacts the productivity or outcomes in a professional setup. From your experience, would you like to share any anecdote or whatever?
Yes. I remember I was in some 2008 or 2009 when I joined as a science communicator. I never knew what kind of an audience I'm going to face. It was in Bhavnagar, Gujarat, and I was fresh from my school teaching experience. That's a train there. The train. My job is to communicate the content of the train to the rest of the audiences. And in classroom school kind of setup, I would have engaged 30, 40, 50, 200, 300 children and not more than that. But suddenly on my day one, you won't believe the crowd that I need to handle is 110,000 people.
Oh.
And I had nobody then to back myself, because that was my first day, and every other peer of mine who joined on the same date, we were on the same boat. Unless we look within ourselves and try to figure it out. They just threw us onto this water, then we need to swim it. And there are 110,000 people, and we need to engage them in communicating the content that is there on the Science Express train. And I had no choice than to look within and feel positive about it. If out of those many people in India, and if there are only 35 chosen science communicators, and out of those 35 science communicators, if I was the one chosen, there's a reason for me to be there. Yeah. So that helped me to regain myself, regain myself, and face the audience and communicate. And when, unlike a classroom where you have only different grades, right? Audience can be of different age groups, just like patients that the nurses need to handle. They are from different age groups. In my case also, my audience were also from different age groups. I need to communicate the content according to their ages, according to their grades from which they come from, according to the language in which they are comfortable. I could see the parallels between my day one 15, 16 years ago versus what you on a daily basis face, all the nurses here who are attending this webinar. So therefore, you need to look within to fight your lower self-esteemed self and see the brighter side of it and face it. I faced 110,000. You are facing much more higher. I faced 110,000 healthy individuals, whereas you are there to care for the people who have come at your doorsteps for a very excellent medical service. So even though there are some parallels between my struggle on day one, but the onus, but the responsibility, but the challenges for you are much more higher. Therefore, you need to be doubly, triply, 1,000 times more positive than I was on that particular day.
Absolutely. I think what we do on a nursing day, I think we should do it every day with before attending every patient, is that I should feel that I am privileged to become a nurse, right? It is with a cause that I am becoming a nurse, or I have become a nurse, right? So it's a blessing actually. Yes. I think that we have to keep in mind while treating each and every patient, not just on a nursing day.
Yes. So let us also see, maybe we are going to be keeping our session very time bound. We have few fraction of seconds now. So over to you, Sarah, for the rest of the beautiful session again. Yeah.
Mostly we can see in the nurses who are having low esteems because they are newly joined, it will influence the work most probably, because they are having difficulty in making simple decisions also. Even a patient who is having low sugars, immediately they are supposed to give 25% dextrose for that. For that, they make sure that somebody need to tell them, they'll be waiting. And they also feel that they are self-blamed and cannot take charge. If something is going wrong, as a supervisor, if I asked it why it has went wrong, but they feel that no, next time I'm not going to take this charge. And also there should be proper team efforts. If the team is not supporting them, if a doctor is coming and writing some medication to be given to the patient, but the nurse have not understand it properly, and she have to come and ask to the team and discuss with the team, and she have to know what is the correct and what is the wrong. And also, we also see that there are also some nurses like if we are giving patient, if a shift senior did not come for duty, we will make sure that when a nurse who is doing well, we will ask them, you take this opportunity to be as a shift senior. But she will say that, no, I will not be able to do that. The better nurse, the other nurse can do better than me.
Yeah, this difference and this opinion or judgment, they started to, feel themselves. That is how we senior, we come in the role, and we must always make sure that we identify their professional strength and give them amazing opportunities, I guess. Yeah. Next slide.
These are some of the factors that are influencing the communication challenges. They are like communication is the main thing. Language, they come from different states, and they are not able to cope up with the language what patient is speaking and what they are supposed to speak. And also team support. If the team is also supporting, they will not be able to understand what the team is saying. And cultural backgrounds, yes, some because of the cultural background, if the doctor is coming for rounds, if he is asking anything, they are not able to maintain proper eye contact and talk to the doctor confidently. Experience and skills, lack of motivation. If there is no motivation, they are going to face the challenges. And they are also role performers in crisis, and also personal stress. They are also having some personal family issues. They will not be able to concentrate.
So I think both of you will agree that these are the factors which will, result in giving a lot of challenges to the healthcare professionals. I think we have quoted almost all of them.
Absolutely.
Yeah. Next slide.
Now we have discussed about low self-esteem. Now what I'm going to do, what we have to do with the nurses who are having low self-esteem, how do we have to get them up? The simple goals that help them to understand is, first is we have to support the team. We have to guide them what is wrong, what is right. Next, we can give them some, we have to identify their strengths and weakness. This is your strength. This is your weakness. You are doing very well in this, but you are weak in this. You have to do this. You have to get back to me. I want to check this. This type of task we will be giving them. Assign some small talks, like giving some case presentation, and we will make them to talk in front of everybody. And also involving them in case presentations and assigning some presentations, but the presentations will be within the peer colleagues only, so that they will have more confidence and they will feel very closely, and they will be able to speak up in a very good manner. Involve them in critical decision making, and also giving some clues if something is going wrong. I can give, if a patient is having a peripheral line with high concentration drugs, then I can ask her, you can go for an EJV. You can talk to the doctor and ask him to go for an EJV instead of putting a peripheral line, so that it will cause infection to the patient because of high concentration drugs. We will explain. We have to use some scenario. Now this has happened. Cardiac arrest has happened to the patient. Now what is your role? What you are going to do? The immediate action, what you will do? This all has to be taught to them and given an opportunity to talk.
So these measures are being taken to empower the nurses and for the better patient outcomes. I think you both will also agree, as you're viewing the slides, or any other points you would like to add from your end, Rajkishore sir or GK.
Yeah, I'll take only 1 minute for that particular cultural background thing. One very interesting anecdote came to my mind. It was about Korean Airlines, where both the pilots who are flying the planes, they were quite well experienced with thousands of hours of experience. But still, Korean Airlines was facing a lot of accidents. You know the reason why? The reason was cultural. Even though both of them equally competent, it is in the Korean culture not to tell the senior pilot if something is wrong, not to tell the senior pilot that what are the other alternatives that are available. So that kind of an empowerment that is not there culturally in the Korean population. Therefore, the Korean Airlines rethought about, completely refurbished their airline industry by doing cultural sensitization exercises for them. I could see the parallels even in the hospital scenario, where the nurse who has spent much more hours with the patient than the doctor, they have seen the patient inside out. They have something else to share with the doctor, but they're not sharing it with the doctor. Let us not make another Korean Airlines example in our healthcare sector.
Yes.
So cultural background and the cultural weightage that each nurse carries, that we need to unburden.
And also, I think the psychosocial aspects of extrovert versus introvert characteristics of one's, attributions also does play a very great role when they communicate with each other. As you rightly said, the Korean culture, and Sarah did mention the cultural background as well. Yes.
Well, being in the healthcare sector, even if I am an introvert, I need to be open and talk to my patient anyways. I had no choice. I have no choice.
Yes.
Validation and the correction by the senior nurses. For the nurses, it is very important what are the things they are doing, what is right and what is wrong has to be assessed by the managers or the supervisors. They have to tell them what is right. These are all the things that you are doing it well. These are the things you are weak and you have to improve. If they are not improving it, we have to make sure that it is being reassessed. What are all the mistakes they are doing at the bedside has to be discussed with them, and we have to train them. We have to if in my area there are 3 in charges and myself, we will divide ourselves and take the staff and train the trainer concept will be followed, and we will make sure that the staff is trained.
Yeah.
And also we will involve them in trainings. What are all the CNE trainings, bedside trainings, on-job trainings, we will involve them, and we will make them to take the trainings, and also appreciate them in front of everybody, so that they feel that the good work is being done by them, is been appreciated, and they will also recognized and they will be rewarded. And make them the mentor for the small group. They will be the team leader and they will lead the complete team, so that it will be very energetic and give them to develop their skills.
But also initially we would like to supervise them as well.
Yes, ma'am. Give them opportunities, never cease to amaze the nurses. First thing is we have to find the gaps, what are all the gaps that are there within the nurses, and we also have to give the action plan for them. What is the action plan that we are going to implement to improve herself, and we have to reassess and involve her in the bigger forum for the trainings. This is also will help them to do their self-analysis. If a junior nurse is there or a senior nurse, she have to make her self-analysis. How is her status? How is her implementation, and what is the progress that has been going in her self-concept?
So I think in the nutshell, we have already come to the end of the session, and as the RK sir and GK will also agree that professional self-concept and clinical performance are co-connected with each other. Okay, so as we were just going through the slides, attempt should be made to improve, and during not only during their employment, also when they pursue their education. The only nurses can contribute for, then only nurses can contribute for productive patient outcomes. I think having said so, we have come to an end, and sir, you would like to give a note of message to the nurses out here.
August has been a very critical and very crucial month for me. Both my dear ones, they were hospitalized 1 week after the other, and both of them were in ICU. I have seen from really close quarters the kind of hardship that each nurse has to go through day in and day out, particularly at the night time. Any patient can cry for help. I have seen them putting extra effort beyond their immediate means. I have seen them noting it down every minute or every hour, whatever they're expected to write their observations, so that the next day when the new shift comes, they were able to communicate it properly. And when the doctor would come for rounds, they would be able to communicate it properly about what has happened the previous night. I've seen it from really close quarters, and I looked at them and I realized you work under extreme pressure. It is not just giving the medicine to the patient, but there is something else that goes beyond that. Those 2 weeks have completely opened my eyes. And I must say, boiling water is same for both potato and egg. What do you have, the coat of self-concept as a hard shell, that is what that will make you harder.
Yes.
If you don't have that self-concept, you'll be squashed like a potato. It's up to you whether you want to have that wonderful shelf which would protect you and make you harder, bolder, stronger, and much more amazing person that you already are in your profession. So be open for that boiling water. That's a never-ending journey in a medical profession. You would keep on treating patients throughout your career. They will have their own problems at different degrees, but you should be ready for those boiling waters. And you need to have that this shell of a self concept to protect you, and you guide you through that to stay stronger and harder.
That was very, great example for the conclusion note. I thank you, sir, for accepting our, webinar invite, and the gratitude of thanks from entire nurses to you from Yashoda Hospitals, Yashoda Management, and thank you. Thanks to Sara and thanks to GK as well for this wonderful session. And the nurses again, every Thursday, keep watching the webinar, and we end the session here. Thank you, everyone.
Thank you.
Thank you.